Operating Room Protocol for health industry representatives and sales professionals. Operating Room Protocol for health industry representatives and sales professionals. The information provided in this online course is intended for educational purposes only. The individuals, staff members, owners, consultants, and any other parties involved in the creation and delivery of this online educational course and any supporting materials hereby unequivocally disclaim any and all liability for any action, advice, or opinion that results from the use or application of this educational material outside of its intended purpose. By partaking in this course, all participants acknowledge and understand it is their duty to abide by the current laws, regulations, and policies that regulate their specific industry and their specific state of residence, and should not rely on this training as a source of legal information or advice. Training objectives: introduction to and overview of the entities that regulate healthcare in general and monitor operating rooms, OR, and physicians in particular. HHS, OSHA, JCAHO, Medical Board, Hospital or Facility. In this training, regulatory is defined to include entities that regulate or influence the behavior of a hospital with respect to quality and safety. These regulators include: 1. U.S. government healthcare agencies. Monitors and enforces compliance with rules and standards. 2. Healthcare industry entities. Accredits and certifies the faculty, e.g., JCAHO, to the degree that their power influences the behavior of hospitals and those who purchase health care. 3. State Medical Board. Ensures proper physician licensing and education. 4. Hospital or healthcare entity. Conducts self-regulation, manages OR resources and OR effectiveness. Government agencies. HHS, Principal U.S. Health Agency. Oversees HIPAA laws. OCR, HHS agency. Enforces HIPAA privacy rule. CDC, HHS agency. Disease control and disease prevention. OSHA, labor agency. Monitors and enforces workers' job safety and health. Department of Health and Human Services, HHS. U.S. government's principal agency for protecting the health of all Americans, providing essential human services, especially for those who are least able to help themselves. Oversees HIPAA standards and regulations. Is comprised of many regulatory agencies, including Agency for Healthcare Research and Quality, AHRQ. Agency for Toxic Substances and Disease Registry, ATSDR. Centers for Medicare and Medicaid Services, CMS. Health Resources and Services Administration, HRSA. Includes the following agencies, continued: Food and Drug Administration, FDA. National Institutes of Health, NIH. National Cancer Institute, NCI. Office of Public Health and Science, OPHS. Office for Civil Rights, OCR. Oversees HIPAA privacy and security rules. Centers for Disease Control and Prevention, CDC. The Office for Civil Rights, OCR, enforces the HIPAA privacy rule, which protects the privacy of individually identifiable health information. HIPAA, Notice of Privacy Practices. Describes how surgery centers may use and disclose protected health information, PHI, to carry out treatment, payment, or healthcare operations, and for other purposes that are permitted or required by law. Describes patients' rights to access and control their PHI in most cases. PHI is any written or verbal patient health information that relates to their past, present, or future physical or mental health or condition. HIPAA privacy rule. Patient rights. Request PHI restrictions. Request confidential communications. Inspect and copy PHI, in most cases. Amend PHI, in most cases. Receive an accounting of PHI disclosures, with exceptions. Complain to HHS if patient believes their privacy rights have been violated. The Centers for Disease Control and Prevention, CDC, monitors and controls infectious diseases and assists other local, national, and international agencies or facilities to prevent the spread of disease. The CDC requires healthcare providers to report some infectious diseases, maintains statistics of rates of infection, provides resources, e.g., infection control and treatment guidelines, and research personnel. The Occupational Safety and Health Administration, OSHA, part of U.S. Department of Labor, establishes and monitors safety regulations regarding workers. OSHA regulations were developed to protect both patients' and healthcare providers' health from bloodborne pathogens, prevent work-related injuries, illnesses, or death. OSHA provides on-site inspections to evaluate workplace hazards and investigate accidents. OSHA provides educational materials to promote workplace safety. OSHA regulations are enforceable under the law. The Joint Committee for Accreditation of Healthcare Organizations, JCAHO, has been renamed the Joint Commission, TJC, is an independent, not-for-profit organization, has no official connection to U.S. government, has no legal enforcement power. However, TJC accredits U.S. healthcare organizations. Many health facilities rely on TJC accreditation to indicate to the public their institution meets quality and safety standards. TJC also certifies healthcare programs, e.g., asthma, heart failure, of the accredited facility. The Joint Commission, TJC. TJC's mission is to continuously improve healthcare for the public by evaluating healthcare organizations and inspiring them to excel in providing safe, effective care of the highest quality and value. All healthcare organizations, except labs, are subject to a 3-year accreditation cycle. On-site evaluation surveys at the facility are unannounced. Currently, TJC accredits or certifies more than 19,000 healthcare organizations and programs throughout the U.S. Patient rights are a primary focus of TJC. The key purpose of a state medical board is to protect patients through proper licensing and regulation of physicians. Public protection begins with the licensure process, which is designed to ensure that practicing physicians have appropriate education and training, abide by recognized standards of professional conduct in treating patients. Medical boards investigate any evidence that indicates a physician is or may be self-regulation, oversees compliance, manages OR effectiveness, monitors OR staff and resources. Surgical staff, surgeon, anesthesiologist or anesthetist, perioperative nurse, circulating nurse, surgical technician, adjunct surgical team member, e.g., sales rep. Surgeon, physician educated and trained in diagnosis, preoperative, operative, and postoperative management of patient care. Surgery requires knowledge of emergency and intensive care, immunology, metabolism, nutrition, pathology, physiology, wound healing, shock and resuscitation. Standard surgical team, 1 senior surgeon, attending, 1 resident surgeon, completing 5-year residency training. Complicated operations can have 3 to 4 surgeons. Anesthesiologist, physician who completes an accredited residency program in anesthesiology, usually of 4 years, following medical school. Administers anesthetics, closely monitors patients' vital signs during surgery and adjusts anesthetics if necessary. Monitors patients through the first recovery stages after operation, administers medications during recovery. Nurse anesthetist, specially trained RN who administers anesthetics, and who generally works under the supervision of a physician. Para-operative nurse, specially trained RN who works closely with patients in the preoperative, intraoperative, and postoperative phases of surgery. Together with other OR professionals, helps plan, implement, and evaluate patient treatment. Circulating nurse, type of surgical nurse who circulates in OR to monitor the procedure, acts as patient advocate, ensuring the conditions in OR remain safe and sterile. Also performs a wide variety of other tasks, which range from helping set up OR for surgery to filling out paperwork that pertains to the surgery. Surgical technician, called scrub tech, are unlicensed but certified, who assist in surgical operations under the supervision of surgeons, RNs, or other surgical personnel. Helps prepare OR by setting up surgical instruments and equipment, sterile drapes, and sterile solutions. Prepares patients for surgery by washing, shaving, and disinfecting incision sites. Helps prepare, care for, and dispose of specimens. Healthcare Industry Representative, HCIR, or Sales Rep. HCIRs, based on their training and expertise, are advisors to the para-operative team, ensure safe and effective application of the surgical product or technology. Presence in the OR is subject to approval of facility and surgeon. Must present written verification of OR course completion, inclusive of OR protocol, bloodborne pathogens, and HIPAA requirements. Usually, must present written proof of current TB testing and hepatitis vaccination. Healthcare Industry Representative, HCIR, or Sales Rep. HCIRs, in the role of educator and facilitator, must not engage in the practice of surgery, nursing, or medical decision-making. Should not be involved in direct patient contact. May be involved in the remote calibration or adjustment of medical devices to the surgeon's and manufacturer's specifications, e.g. pacemakers. Should have their activities monitored by the para-operative nurse responsible for the patient's care. HCIRs must document all items taken into the OR. The OR is a distinctive environment within a healthcare facility where surgical procedures are performed to diagnose and treat patients' disease or injury. The OR is a highly restricted area. It is regulated by many laws and professional guidelines. Successful surgery therefore requires a multidisciplinary team and well-organized processes and controls that address many aspects, from long-term goals to OR best practices. It is critical for staff and HCIRs to understand how to work in and around the OR environment. Lesson 2 will provide in-depth information on the operating room processes, controls, and environment. Thank you. Operating room protocol for health industry representatives and sales professionals. Lesson 2, personnel, controls, and environment. Liability disclaimer. The information provided in this online course is intended for educational purposes only. The individuals, staff members, owners, consultants, and any other parties involved in the creation and delivery of this online educational course and any supporting materials hereby unequivocally disclaim any and all liability for any action, advice, or opinion that results from the use or application of this educational material outside of its intended purpose. By partaking in this course, all participants acknowledge and understand it is their duty to abide by the current laws, regulations, and policies that regulate their specific industry and their specific state of residence, and should not rely on this training as a source of legal information or advice. Training objectives. Introduction to and overview of operating rooms, OR, processes, controls, and environment, including operating room overview, surgical team, sterile field, sterile practices, surgical phases, universal precautions, surgical environment. Basic understanding of the OR. All activities in ORs are centered on best possible care of patient. Responsibilities of every member of surgical team are clearly defined in writing in the hospital's operating room SOP, Standard Operating Procedure Manual. The SOP policies must be strictly followed and are necessary for safe and efficient surgery. The SOP policies also demonstrate compliance with state and federal laws and ensure the hospital meets the minimum standards set by the Joint Commission, TJC. Policies for performing procedures vary among ORs, but techniques for aseptic and sterile practices are basic to every surgical procedure. Some of the following words have been defined in previous lessons, but are included to refresh your OR vocabulary. Antiseptics, chemical agents that fight sepsis by inhibiting growth of microorganisms without necessarily killing them. Asepsis, the absence of pathogenic microorganisms. Aseptic technique, any process or procedure utilized to reduce number of contaminants or prevent transfer of microorganisms. Barriers or bagged, method of enclosing supplies and equipment. This may be done by plastic or paper to prevent the spread of infection or to maintain sterility. Definitions continued. Cross-contamination, transmission of microorganisms from patient to staff or from contaminated objects to patients and vice versa. Disinfection, chemical or physical process of destroying all pathogenic microorganisms except spore-bearing ones. High-level disinfection, disinfection process that kills spores. Sanitation, process to reduce microorganisms present on an object to a level considered safe for human use. Sanitizer, apparatus utilizing sanitizing agent, such as hot water, steam, or chemicals. Sterile, free of microorganisms, bacteria, spores, germs. Sterilization, process by which all pathogenic and non-pathogenic microorganisms, including spores, are killed. The surgical team is a unit providing continuum of patient care beginning with preoperative care and extending through intraoperative during the surgery procedures and postoperative recovery. Each specialist on team has advanced training for his or her role before, during, and after surgery. Number and type of personnel who comprise team depends on size of hospital and nature of surgical caseload. Organization, titles, ranking, and educational requirements of team members vary from hospital to hospital. Roles of OR personnel. Review. Operating surgeon. Physician specialist with ultimate responsibility for performing surgery that is safe and effective. Anesthesiologist. Physician specialist trained to administer anesthetic agents to surgical patients. Trained to provide immediate care in the event of physiologic crisis. Nurse anesthetist. Highly trained RN who renders same care as anesthesiologists, but must work under their supervision. Perioperative nurse. Specially trained RN who works closely with patients in the preoperative, intraoperative, and postoperative phases of surgery. Roles of OR personnel. Review. Circulating nurse. RN may also have advanced degree, may act as an instrument or scrub nurse or a surgical assistant. Surgical technician or technologist, also called scrub tech, is unlicensed but certified, who performs a variety of duties in the course of surgical operations. Paraprofessional personnel, including surgical technicians, are accountable to circulating nurse. Surgical team members function in two capacities, non-sterile and sterile. Sterile field, a designated area within the OR that is sterile according to surgical asepsis. All materials used as part of a sterile field for an operation must be sterile. If you are an HCIR or sales rep in the OR, you need to be trained in OR protocol so that you do not create havoc in the OR by contaminating the sterile field. It includes having all personnel scrubbed and properly attired, having furniture and equipment covered with sterile drapes. If you touch anyone or anything in the sterile field, you compromise sterility. Sterile field. Only sterile items are used. The patient is the center of the sterile field. Tables are sterile only at table level. Areas below the level of the draped patient are considered non-sterile. Linen or sutures falling over edge of table should be discarded. The sterile table and sterile items must be monitored at all times. If not, they must be considered non-sterile. All supplies for sterile team members, scrub, surgeon, etc., are provided by circulating nurse, non-sterile team member, who protects sterility of items via use of wrappers on sterile packages. Sterile field. Sterile persons are gowned, masked, and gloved. Gowns are sterile in front from chest to level of sterile field. Sleeves are sterile from 5 centimeters above elbow to the cuff. Masks are sterile, gloves are sterile. Keep hands at waist level and in sight at all times. Keep hands away from your face. Keep your elbows close to sides of body. Never fold hands under arms, as your gown may be moist with perspiration, resulting in contaminated gloves. Sit only if sitting for entire procedure. Sterile field, review. Sterile persons. Touch only sterile items or areas. Avoid leaning over non-sterile area. Non-sterile persons. Touch only non-sterile items or areas. Never reach over sterile field. Must maintain distances of at least 1 foot around sterile field. Never walk between 2 sterile fields. Practices of PPE. PPE, personal protective equipment. Gloves, surgical gowns, masks, protective eyewear, cloth caps, shoe covers. All things that come into contact with a wound should be sterile from microorganisms or as free as possible for the protection of patient and OR personnel. Practices of PPE. Refer to Lesson 3, Operating Room Protocol for step-by-step instructions on applying PPE. Preoperative phase. Patient's arrival to the OR suite. Patient assessment, evaluation, and expected outcome of surgery is discussed and documented. Any irregularities noted in the patient's physical or emotional condition are communicated to surgeon. Patient preparation for anesthesia is started. Patient grounding device is applied when applicable. Patient is kept warm and comfortable while awaiting start of surgery. Intraoperative phase. This phase extends from the time the patient is brought into the operating room to the time of anesthesia administration and performance of the surgical procedure, until the patient is transported to the recovery room or post-anesthesia care unit, PACU. Intraoperative phase continued. Induction of patient's anesthesia is initiated. Aseptic environment within OR must be maintained. Procedure for universal precautions during surgery must be strictly followed. Any irregularities or incidents that occur during surgery must be documented. Postoperative phase. Postoperative recovery starts in the post-anesthesia care unit, PACU, sometimes referred to as post-anesthesia recovery, PAR. It takes time for anesthesia to be eliminated from the body's tissues. Most people do not experience any problems following surgery and anesthesia. Serious complications of an anesthetic are very rare. Minor and temporary side effects of anesthesia may be experienced in some cases. This will depend on the surgery performed and overall health status of the patient. Postoperative phase, PACU, continued. Patient needs and vital signs are assessed frequently, especially respiration. Patient is monitored for any postoperative symptoms. Analgesic or antiemetic medication for any pain or nausea and vomiting may be administered. Patient's surgical site is monitored for excessive bleeding, discharge, swelling, etc. Appropriate postoperative care is provided. After the effects of anesthesia have worn off completely and patient's condition is considered stable, patient will either be transferred to their hospital room or discharged, outpatient surgery. Duty of circulating nurse during surgery is to ensure that OR environment is kept as decontaminated as possible by confining and containing all potential contaminants. The following activities, called universal precautions, must be carried out to prevent cross-contamination of bloodborne pathogens. Any blood spills should be promptly removed using a hospital-grade disinfectant. All items used and discarded during surgery must be placed in containers that are leak-proof. Universal precautions. Preventing cross-contamination of bloodborne pathogens. Any contaminated items must be handled in a manner that protects the patient and personnel from contamination. Personal protective equipment, PPE, must be worn by all scrubbed and non-scrubbed personnel, including gloves, cover gown, face shield or mask, and protective eyewear. Tissue specimens, blood, and all other body fluids must be placed in a leak-proof container for transport out of OR. Universal precautions. Preventing cross-contamination of bloodborne pathogens. All attempts should be made to keep patient charts, lab slips, X-ray reports, and other paper documentation from contamination. Contaminated sponges must be collected in kick bucket, which has a plastic bag or liner. Instruments that fall off sterile field must be retrieved by circulating nurse and placed in basin containing non-corrosive hospital-grade disinfectant. General surgical environment. Physical structure and layout of the OR. Layouts vary from hospital to hospital, but goal of all design concepts are to ensure patient safety and work efficiency. Due to constant danger of contamination to surgical patients, design of OR suite clearly delineates clean, restricted, from hazardous, unrestricted, or contaminated areas. Unrestricted areas carry high potential for cross-contamination by disease-carrying organisms. Surgical team members in sterile attire must keep well within clean or sterile areas. Physical structure and layout of the OR continued. It is important to understand which areas of the OR suite are clean, restricted, which are contaminated, and which are mixed. The patient receiving area, dressing rooms, holding areas are considered unrestricted. The hallways between various rooms in the OR suite are semi-restricted. The ORs themselves, scrub sink areas, and sterile supply rooms are all restricted. Full surgical attire, including masks, must be worn in all restricted areas. Physical structure and layout of the OR continued. Sterile supply room. A clean area which stores all sterilized or packaged instruments and supplies for surgery. Scrub sink station. Found in various locations close to ORs. Also contains caps, masks, antiseptic soap, scrub brushes, and eyeglass defogging agents. May hold protective eyewear for universal precautions. Scrub sinks must never, under any circumstances, be used for cleanup of equipment or instruments. Physical structure and layout of the OR continued. Equipment room. Used to store large apparatus such as operating microscope, image intensifier, laser machine. Anesthesia supply room. Used to store all equipment needed by anesthesiologists. Substerile rooms. Are located between one or more OR suites. Typically include refrigerator for small tissue grafts, medications, solutions, blanket warmer, autoclave for sterilizing unwrapped instruments and equipment. Operating room, design and environmental control. Designed for maximum patient safety. Roomy enough to allow scrubbed personnel to move around non-sterile equipment without contamination. Floors, ceilings, other surfaces are smooth, non-porous, and constructed of fireproof materials. Allows thorough cleaning of biologic material that could cause cross-contamination. Operating room, design and environmental control. Ventilation system in OR engineered to prevent possible contamination of clean environment by airborne bacteria. Current requirements call for 20 exchanges of air per hour, 4 of which must be fresh. Humidity is controlled to minimize static electricity and ignition of flammable solutions or objects used in OR. Ideal humidity level to achieve minimal static and also reduce microbial growth is 50% to 53%. Air temperature is maintained at 20 degrees Celsius to 24 degrees Celsius, 68 degrees Fahrenheit to 73 degrees Fahrenheit. Operating room, design and environmental control. Lighting in OR is achieved by use of main overhead fluorescent lights and by surgical spotlights. Halogen lamps are used within the surgical spotlights. Electrical system in OR meets minimum standards set by the National Fire Protection Association, NFPA. All outlets are grounded and explosion-proof. Rigid outlet columns that extend from ceiling are designed to receive electrical cords, suction, and compressed air. Operating room, hazards. Electrical. Cautery units, defibrillators, OR beds. Numerous pieces of equipment. All equipment must be checked for electrical safety before use. Anesthetic waste. Dispose properly according to regulations. Radiation. Handle leaded aprons and shields used during procedures appropriately. Laser safety. Use protective eyewear for patient and operating team. Doors must remain closed with sign. Danger, laser in use. Sterile water must be available in the OR. Smoke evacuation system is to be employed when applicable. Surgery high filtration masks should be worn during procedures that produce a plume. General safety. OR beds and gurneys must be locked before patient transfer. Operating safety belts will be used for all patients. Electrical equipment must never be connected or disconnected with wet or moist hands. All needles, razors, scalpel blades, and broken glass must be discarded into special identified containers. Remember, only knowledgeable and trained healthcare industry representatives or sales representatives will be permitted access to the operating room for the purpose of providing technical support during a surgical procedure. Stay alert, stay healthy, and make a contribution to the positive patient outcome. Operating room protocol for health industry representatives and sales professionals. Lesson 3, Aseptic Techniques for Infection Control. Liability disclaimer. The information provided in this online course is intended for educational purposes only. The individuals, staff members, owners, consultants, and any other parties involved in the creation and delivery of this online educational course, and any supporting materials, hereby unequivocally disclaim any and all liability for any action, advice, or opinion that results from the use or application of this educational material outside of its intended purpose. By partaking in this course, all participants acknowledge and understand it is their duty to abide by the current laws, regulations, and policies that regulate their specific industry and their specific state of residence, and should not rely on this training as a source of legal information or advice. Training objectives. Introduction to and general knowledge of the methods and levels of aseptic technique, decontamination. Cleaning. Definition, general recommendations, and procedures. Disinfection. Definition, general recommendations, and procedures. Sterilization. Definition, general recommendations, and procedures. Aseptic overview. Asepsis is the absence of pathogenic organisms, e.g., bacteria, viruses, in a medical or health-related setting. Aseptic technique is any process or procedure utilized to reduce number of contaminants or prevent transfer of microorganisms, with goal of maximizing and maintaining asepsis. 4 types. Clean. Uses basic, routine cleaning techniques. Disinfect. Uses medical techniques. Surgical. Uses sterile techniques. Barriers. Uses containment, e.g., surgical attire, medical device bagging, to prevent or control spread of contaminants. Antiseptics are antimicrobial substances capable of preventing infection by inhibiting growth of microorganisms. Decontamination risk level. Types of hand hygiene. Clean, routine. Purpose, cleansing before and after patient contact. Risk level, low. Products or agents. Warm water and use of non-antimicrobial soap. Residual effect, short. Disinfect, medical. Purpose, hand antisepsis, or to remove antimicrobial resistant pathogens to harmless level. Risk level, intermediate. Products or agents. Use of aseptic products, e.g., alcohol, sanitizing foam, sanitizing gel, or lotion soap. Residual effect. Can be sustained, depending on product or agent. Sterile. Purpose. Process that kills or removes all microorganisms, including resistant spores. Risk level, high. Products or agents. Surgical scrub, iodophores, betadine, chlorhexidine gluconate. Residual effect. Can be prolonged, depending on agent. Elimination of infection is goal of asepsis. Although it's impossible to keep your hands germ-free, washing your hands frequently is first line of defense against SARS, foodborne illnesses, the common cold, the flu, and other infectious diseases. In all medical settings, hand-washing techniques are an important step in asepsis. Overview summary. Questions? If you have questions about high-level disinfectants, sterilants, or how to clean, disinfect, or sterilize a particular medical device, first contact the manufacturer of the product. If you are unable to obtain sufficient information in this manner, contact the Food and Drug Administration, FDA, Regional Office, or FDA Center for Devices and Radiological Health at 301-443-4690. Clean technique. Definition. Clean technique is also known as routine hand washing. Removal of dirt, organic material, and transient microorganisms with plain soap and water or an alcohol-based hand sanitizer, a cleanser that doesn't require water. Hand drying and/or use of non-sterile gloves. Preferably done before disinfecting hand wash if the hands are visibly contaminated. Essential step before a sterile scrub. Indications. Hands are visibly dirty, contaminated, or soiled. Or after eating, blowing nose, coughing, sneezing, touching garbage, using toilet, or touching any waste product. Before putting on and taking off gloves. Before providing non-invasive procedures, e.g., taking blood pressures, feeding patients, etc. Before providing invasive procedures. Before having contact with patient skin and/or mucous membranes, body fluids, excretions, etc., or other body parts. Before leaving patient's room. Or after touching, with bare hand or gloved hand, any object that may be contaminated by blood, saliva, or fluids, e.g., wound dressings, medical devices. Procedure. Routine hand washing techniques for most clinical settings involve a series of steps. 1. Remove jewelry prior to hand washing. 2. Avoid clothing contact with sink. 3. Wet hands with running warm water. 4. Dispense generous amount of approved soap or cleanser into palm of hand. 5. Wash each hand for minimum of 15 seconds, creating vigorous friction. 6. Scrub the backs of each hand, between fingers, cleaning under fingernails and washing wrist area. 7. Rinse both hands under running warm water, removing soap residue. 8. Allow water to flow down forearms, keeping hands lower than elbows. 9. Dry hands using disposable towel for each hand. 10. Use towels to turn off faucet. Do not touch faucet with bare hands. Tip: short, less than a quarter-inch, natural, unpolished fingernails will allow for a more thorough cleansing. Disinfection technique. Definition: antisepsis hand washing is the use of water and antimicrobial soap or detergents containing agents that will reduce concentrations of resident flora and inactivate transient microorganisms from hands before glove use. Disinfecting agents include iodine, chloroxylenol, chlorhexidine, etc. Antiseptic hand rub, alcohol-based hand rub, or waterless antiseptic agent containing 60% to 95% ethanol or isopropanol. Indications: before, putting on gloves for short invasive procedures. Put gloves on according to sterile gloving guidelines shown in later slide. Procedures that include suctioning, placing an IV or urinary catheter, medications. Patient care of those at high risk of infection, e.g., HIV, AIDS patients. Contact with other parts of patient's body. Leaving patient's room. Tip: the duration of aseptic hand washing is important, not only for mechanical action to be effective, but also to allow antimicrobial products sufficient time to be effective. Minimal time required for disinfecting hand wash before rinsing is 2 minutes, or according to manufacturer's instructions. Doing it the right way. 1. Remove jewelry prior to hand washing. 2. Avoid clothing contact with sink. 3. Wet hands with running warm water. 4. Dispense approved antiseptic cleanser into your palm. 5. Wash each hand for minimum 1 minute, creating vigorous friction. 6. Scrub the backs of each hand, between fingers, cleaning under fingernails and washing wrist area. 7. Rinse both hands under running warm water, removing soap residue. Doing it the right way. 1. Allow water to flow down forearms, keeping hands lower than elbows. 2. Dry hands using disposable towel for each hand. 3. Use towels to turn off faucet. Do not touch faucet with bare hands. If using antiseptic hand rub, 1. Apply product to palm of hand in amount recommended by manufacturer. 2. Rub hands together, covering all surfaces of hands, fingers, and wrist area until dry. Sterile technique. Hand washing. Definition: a sterile scrub is an antiseptic hand wash or hand rub performed prior to surgery, in preparation for surgery, by a participating healthcare provider in a sterile area. Requires use of long-acting, powerful, antimicrobial soap or agent on the hands and forearms. Requires using soap or agent for longer period of time than used for typical hand washing. Requires hands dried with sterile towels. Requires sterile gown, sterile mask, sterile gloves, and sterile supplies. Indications: before, putting on sterile gloves, surgery and other invasive procedures, placing of thoracic lines, central lines, etc. Procedure: the CDC recommends at least 2 to 5 minutes of scrubbing. Thorough drying is essential, as moist surfaces invite the presence of pathogens. Contact with the faucet or other potential contaminants should be avoided. The faucet should be turned off with a dry paper towel, or in many cases, through the use of a foot pedal. Despite this careful scrub, bare hands are always considered potential sources of infection. Sterile technique. Gown guidelines. Technique for gowning oneself. 1. Grasp the gown firmly and bring it away from table. It is usually folded so that the outside faces away. 2. Holding the gown at the shoulders, allow it to unfold gently. 3. Do not shake gown. 4. Place hands inside gown armholes and guide each arm through the sleeves by raising and spreading the arms. 5. Do not allow hands to slide outside cuff of gown. 6. The circulating will assist by pulling gown up over the shoulders and tying. Technique for gowning another team member. The scrubbed tech or nurse gowns surgeon after he or she has performed the hand scrub. After handing surgeon a towel for drying, the tech or nurse allows the gown to unfold gently, ensuring there is enough room to prevent contamination by non-sterile equipment. Sterile technique. Gloving guidelines. Sterile gloving guidelines. CDC hand hygiene recommendations. Putting on sterile gloves requires a specific technique so that the outer glove is not touched by the hand. It is essential in both open gloving and closed gloving, putting on gloves with a sterile gown, that the sterile gloves do not become contaminated. Procedure. Open gloving. Inspect the glove package for signs of contamination. Discard if you find any of the following: water spots or moisture, tears, any other evidence of damage or contamination. Open the sterile package. 1. Place the package on a flat, clean, dry surface in the area where the gloves are to be worn. 2. Peel the outer wrapper open to completely expose the inner package. Position inner package. 1. Remove the inner package, touching only the folded side of wrapper. 2. Position the package so that the cuff end is nearest to you. Unfold the inner package. Open the package to a fully flat position without touching the gloves. Expose both gloves. 1. Grasp the lower inside corners or designated areas of package. 2. Pull gently to the side without touching the gloves. Put on the first glove. 1. Grasp the cuff at the folded edge and remove it from wrapper with one hand. 2. Step away from the table or tray. 3. Keeping hands above waist, insert the fingers of other hand into the glove. 4. Pull the glove on, touching only the exposed inner surface of the glove. Note: if you have difficulty in getting the fingers fully fitted into the glove fingers, make the adjustments after both gloves are on. Put on the second glove. 1. Insert the fingertips of the gloved hand under the edge of the folded over cuff. Note: the gloved thumb may be kept up and away from cuff area or may be inserted under edge of the folded over cuff with the fingertips. 2. Keeping the hands above the waist, insert the fingers of the ungloved hand into the glove. 3. Pull the glove on. 4. Do not contaminate either glove. Adjust the gloves to fit properly. 1. Grasp and pick up the glove surfaces on the individual fingers to adjust them. 2. Pick up the palm surfaces and work fingers and hands into the gloves. 3. Interlock the gloved fingers and work the gloved hands until gloves are firmly on the fingers. Note: if contamination occurs during either procedure, both gloves must be discarded and new gloves must be added. Procedure: closed gloving. Putting on gloves with a sterile gown. 1. As hands will be covered with gown sleeves, a team member must open the inner package of sterile gloves. 2. With non-dominant hand, inside gown cuff, pick up glove by grasping folded cuff. 3. Extend dominant forearm with palm up. Place palm of glove against palm of dominant hand. Glove fingers will point toward elbow. 4. Grasp back of glove cuff with non-dominant hand and turn glove cuff over end of dominant hand and gown cuff. 5. Grasp top of glove and underlying gown sleeve with covered non-dominant hand. 7. Carefully extend fingers into glove, ensuring glove's cuff covers gown's cuff. 8. Glove non-dominant hand in same manner. Use gloved right hand to pull on glove. Keep hand inside sleeve. Note: if contamination occurs during either procedure, both gown and gloves must be discarded and new gown and gloves must be put on. Removal of gloves. 1. Grasp one glove at the heel of hand with the other gloved hand. 2. Peel off glove, retaining it in the palm of gloved hand. 3. Reach under the cuff of remaining glove with 1 or 2 fingers of ungloved hand. 4. Peel off glove over glove being held in the palm. 5. Do not contaminate self. 6. Discard gloves according to local standard operating procedure. 7. Perform a decontamination hand wash. Note: when removing gloves after procedure is finished, gloves are removed after gown is removed inside out, using glove to glove, then skin to skin technique. Accidental contamination. Avoid contaminating yourself or others. Wear sterile gloves to protect yourself from patient's pathogens, while protecting patient from environmental pathogens. Dispose of equipment and secretions properly. Accidental penetrating injuries are an occupational hazard. Put all equipment and specimens in moisture-proof containers for transportation. Be careful not to contaminate yourself or the outside of container. Follow facility policies for disposal of or cleaning contaminated surfaces and materials. Lesson summary. The goal: reduce healthcare-associated infections. Infections occur when staff spread microbes to patients or from patient to staff. Germs move to patients from hands and from objects used for patient care. Prepare in advance for the type of hand hygiene that is necessary. Use of clean, disinfection, or sterile technique reduces the number of germs transferred and thus reduces the risk of infection and disease.